Good afternoon. My name is Kevin Barton. I'm going to be demonstrating the PPE, donning and doffing, as well as the washing hands and alcohol and the cross contamination demonstration. So first off, what we do is we walk into the patient's room. Before we enter, we knock on the door, and then we say we open it, introduce ourselves. Hello, my name is Kevin Barton. I'm a student nurse. Uh, may I take care of you? And they say yes or no. And then after that, we go and we start washing our hands. So first things first, we're gonna go turn on the sink, wet our hands, put some soap in the dispenser, and then we start washing in circular motions, trying to get the soap all over our hands, with the wrists, beneath the nail beds, around the thumbs, and we're doing this for at least 20 seconds, keeping our hands below the elbows while we're washing. So next, after we do that, we're gonna rinse our hands with water, get all that soap. Again, making sure it's at least 20 seconds. And then we're gonna go and get a paper towel. So with paper towel, we'll start drying our hands. Keeping the hands below the elbows at all times, never raising it. But at the same time, trying to keep our hand from touching anything. And then with the same paper towel, we're gonna turn off the faucet and then discard. And that's it. That's how we wash our hands with soap and water. And then, let's say we're not gonna use water. Let's say we're gonna use alcohol. So instead of using the whole process of water, we do the same thing but with alcohol. We're gonna grab alcohol, put it in our hand, rub, making sure to get all the surface area, and we rub dry until for at least 15 seconds. 15 seconds or longer until completely dry. Make sure you hit all the spots, as we said before. And that's it. That's alcohol and the water. So now we're gonna start with donning of the PPE. So what we're gonna do is first thing to don is gonna be the gown. So after we put the gown on, next thing is the mask. I'm looking for my mask. Okay. Now after the mask, face shield or goggles. I don't have the face shield that I was initially given, so I'm using these as a reference or as a substitute. But in this case, these goggles would be the face shield. And after the goggles, the face shield, the last thing would be the gloves. And when you're putting on the gloves, you make sure the gloves go over the gown, over the cuffs, making a secure seal. Again, over the cuffs, a secure seal. Now, to prevent cross-contamination, you're always going to use basic common sense. You're not going to touch the dirty area to a clean area. You're not going to use the same PPE to different patients. You're not going to contaminate sterile space by going from a dirty area to the sterile area. You're going to keep that sterile area completely sterile by following the proper procedures. You're not going to turn your back on the sterile area. You're not going to put your hands below your waist if you have sterile gloves. You're not going to touch the patient and then come back and start touching inside the sterile area. You're going to keep basic common sense that you're not going to bring anything dirty to somewhere that's clean. And you're not going to go from an obviously dirty area into an open wound or something like that. You want to keep that completely separate so the patient doesn't get any foreign particles, bacteria inside their body causing sepsis or anything. So after that, we take over the patient, we do what we need to do. We're going to start docking our PPE. So the first thing is we're going to remove our gloves. So, for the dominant hand, we go to the non-dominant hand, pull the gloves, inverting them, and then we're going to hold it with this hand. This hand, we're going to go underneath, invert, and then we're touching the inside and never the outside surface. So after this, we throw away and discard our gloves. The next thing is we remove our face shield or goggles. So that's removed. Finally, we're going to remove